Colombia! In this video, we're headed back to Medellin, Colombia. We're speaking to Ed Richardson, who has boots on the ground, to give you guys a little heads up on medical care in Colombia before you head down. Follow along. Okay, so good morning, good evening, good afternoon, wherever it is you're located. I am with Ed Richardson in Medellin, Colombia, and today we're going to discuss healthcare in Colombia, and more specifically for those that we know that are going to Medellin, or really anywhere in Colombia. So this is going to be the same no matter where you are in Colombia. So, well, Ed, you want to introduce yourself right quick?
Yes, my name is Edward Richardson, and I'm from San Diego, California, and I moved to Medellin last May.
Yeah, man.
And been here since last May. And I, still an engineer in the transportation industry. I work in public transit with the light rail, buses, and all forms of public transportation. So I came here to just relax, but I still do some work in public transportation in the U.S. But I've been here about a year, and I love it in Medellin. We spell it Medellin, but we pronounce it Medellin. So we are on this site today to discuss healthcare.
Exactly. So you went from San Diego, I forgot, you went from San Diego to Medellin, the best weather in the U.S. to the best weather in South America.
Okay, right. Now, let me explain to you about the weather in San Diego. When I moved to San Diego in 1980, the weather was like Medellin. But since that time, because of global warming, the weather has dropped 15 degrees at night in San Diego during the winter. So we have nights when it drops in the 40s at night.
Yeah.
And Medellin, it never dropped below 65 at night since I've been here. I've worn a long sleeve shirt 2 times, and that was when it rained, and I didn't need it on then. So the weather here is just perfect,
Yeah, and for those who've seen any of my prior videos while I was in Medellin, I never shut my windows or my balcony door. Never shut it. The entire time. One night I did. I think it got too cold. There were no bugs coming through, which is one thing you have to contend with here in a lot of different areas.
Right.
And I noticed that if a fly or something did come in, don't worry about it. He'll just end up going right out the other side. So
exactly.
It was cool.
Right.
So there's many reasons to move to Medellin, but the one we're going to talk to today about is for healthcare. So we discussed before I got this recording straight that, the first thing you want to do is, even before you get there, you need to schedule an appointment with someone, with a healthcare provider, and get all your paperwork together and set up a time for a meeting when you get there. Is that right?
Right. Okay. You got 2 appointments you can make. If you're a vet and you've been a veteran, you can make an appointment with the vets here. And it's a gentleman here that handles all vets, because if you want to get a retirement visa or health care, you go to the Veterans Administration here. And they're an extension of the agency in Panama. Then people like us who are civilians, we go through a person that's assigned to us, that we have people here that can walk you through the health care process.
Okay, so if you're a vet, then a particular guy that you reach out to?
Yeah, it's a guy here. I had breakfast with him on Father's Day, and he's an ex-Marine sergeant. He handles everything that veterans have here. Health care, retirement visas. There are lawyers in his office that will just walk you through the process, and it's much cheaper than going through a private person.
Okay. So do you need to meet with him as soon as you get there and then you schedule for your appointment?
Now, you don't have to meet with him when you get here. You just have to text him. I'll give you his private number. You text him and let him know you're coming. And then when you get here, you just make an appointment with him. Very nice guy. Very nice. I mean, I wouldn't think he'd ever been a sergeant, but he's a great guy.
Okay, so I'll get that information and I'll put it down in the description for everybody who's watching.
Okay.
But so if you're not a veteran, what's the process then?
If you're not a veteran, the process is to, you know, they have American lawyers here who have agencies where you can go to them and they will walk you through it. But it could cost anywhere from $500 to $900. And then there are private people who that's all they do is they walk you through the process of getting your visa and your health care.
Okay.
And so, you know, it's a process. It's health care, it's visa, it's cellular, and it's all that in one. You know, and yesterday I forgot to tell you that when you're going through your visa process, you have a stamp in your passport. That's one page. It's a visa on your page. So when you enter the airport, when you come back and forth with from the United States, the inspector, he can see that you have a visa. And when you're out in the street and you don't have your passport with you, you have a cellular, which is a Colombian ID card, and you take that around with you.
Okay,
so
yeah.
You go in store.
I was going to say, so let's jump on that then, the cedula, because like we said yesterday, you cannot get the healthcare until you have the cedula first. So can you explain what a cedula is and then what's the process to get one?
Okay. A cedula is just a Colombian ID card that all Colombians have. And your cedula card is going to have the word migrant on it. It means that you're not a born Colombian, you're a migrant, you're from somewhere else. And everywhere you go, if you're here and you don't have your passport, you don't have to take your passport with you. You just use your cellular to get in grocery stores. You use it with your credit card, and because every time you use your credit card, they're going to ask you for your photo ID.
Okay.
And that helps you for anything you want to do here.
Okay, so is it a card or is it paper?
Okay, I'll show it to you. I have it here.
But don't show your numbers though.
Yeah, it doesn't matter.
Oh, okay.
That's it.
Gotcha.
And it's got a stamp on back. And what we do is after we get the cedula, we take the cedula and go to a print shop and we have it laminated. So I have 4 or 5 copies of this, and I keep my original one in my apartment. I only travel with my original one. Also, you can travel in Colombia, airports, wherever, and you can use this and they'll take it. But I never keep my original with me because I don't want to lose it. If I lose it, I got to go back into immigration, stand in all those lines. So I made 4 or 5 copies, so I would have.
Okay, so the cedula is something that you need if you're going to stay in Colombia for more than 6 months, right?
Right, more than 6 months. So if you come to Colombia and you want to work on your cedula, you should stay at least 3 weeks for the process.
Okay. You know. So that's even prior to getting the healthcare. So first thing you need to step through is we'll say a hoop, but you need to get the cedula filled out, or you need to get the paperwork done for the cedula first. It takes like 3 weeks to get it?
Yeah, 2 to 3 weeks.
2 to 3 weeks, and then they mail it to you.
He came here. Yeah, I know a guy that came here Christmas. He went one day, his paperwork went to Bogota. It was back the next day. And 2 weeks later, he had his cedula in his hand and his visa stamp in his passport.
Okay. So then you have the full page stamp in your passport, you have your cedula. Now you can set up, or you can call for an appointment to speak to a healthcare provider. Right.
You can, it's a lady here that I know that took me through the process. She just took me there. I went there, we had an appointment. Once you get your cedula, she makes an appointment for you. It takes 2 to 3 weeks for the appointment. Once you go to the appointment, it takes about 15 minutes, 15 to 20 minutes for her to sit there, speak Spanish to the administrator. And then when you're done, you got paperwork and your healthcare is effective right then.
Okay, so that's 3 weeks after the first meeting.
Right.
Okay, so you meet with the person first, you do all the paperwork, and she does what she has to. You get your appointment, which will be about 3 weeks later. But when you get your appointment, she goes in with you, you go through the process, 15 minutes later, it's effective immediately.
Right. Now, if you have to say you're here 3 weeks and you got your surgery before you left, you can go home, work, do what you got to do. Then contact her when you come back and then make an appointment for your healthcare.
Okay, so this one thing I didn't understand. If you get a cedula, let's say I go there, I go through the process to get the cedula. To get it within 3 weeks, do I have to have a visa, like a student visa or a retiree visa? I have to have one of those before I can get my cedula, or can I just come down off the plane and try to get the cedula?
No, okay. Most people, they get several retirements. You have a retirement visa. All you have to do for that is bring your passport. 2 is go to your Social Security, go to SSA.com, download your Social Security benefits letter. That's a 1-page letter that states how much you get a month on your Social Security. Okay. You download that, print it out, bring that and the passport here, along with the fees that you're going to require to go through the process. The fees to go through the process total about $550. In that, $250,000 is the latest fee for helping you walk through everything, the process. So you're going to have to go with her about 2 or 3 times somewhere while you're here, to get notaries or whatever. And then once you got all those notaries, you go back to immigration, the desk, and the lady there processes your paperwork and sends it to Bogota. Once he sends it to Bogota and comes back, then you're ready to go over next door to the immigration office to take a picture ID and fingerprints. 2 weeks later, you have your cedula. Now, did I confuse you?
No, I got it. But I think everybody should know that you don't have to have a retirement visa because you can get a student visa instead.
Right. You get a student visa. You can get a retirement visa. Oh, I said retirement. Student visa. You can get an investment visa, which is you buy a property here, condo or whatever, or you can get a what you call a business visa to set up a business firm here or something.
Okay, so a student visa is only good for a year?
It's a year.
But
and
you
then you just renew it again if you want again.
Okay, so that's for everybody who's not military.
Carlton will help you there.
Okay, yeah, no, I was saying for everybody who's not military or retiree, probably the easiest step would be to go through the process to get a student visa, then get your cedula. But what's the process to get a student visa? Is it the same time lag, like 3 weeks?
Yeah, I have you can do a Zoom with Carlton on that. Because that's what he did, because I think he came here at 59 or 60. And he came here and he'd been using student visas. I think he turns 62 this year, so he's going to get the retirement visa. So Carlton got the student visa. Student visa is not cheap. It's going to be about $1,500. But somehow you said, because you go into classes, but Carlton found a way to not go to the classes and still be here. Okay,
do you know if that $1,500 includes the schooling also? Or is that just $1,500?
No, the $1,500 is the schooling.
Okay, so you're getting the classes and you have the visa. So it's more valuable.
Right, you basically, right. So like me, I take lessons from individual people that I meet here. And I'd rather take it from the Colombians because that way I get the accent right. And I do a lesson maybe every other week, and I study myself on this website that I'm going to give you. And it cost me 30,000 pesos per lesson, which is 1 hour. 30,000 pesos is $8, $9. You know?
Yeah.
And they also will give you a group of lessons for a fee. But I don't like the strain, so I do it every 2 weeks, and I study online.
But if you do it privately, though, that does not count towards your visa, right? It has to be like an accredited school to be able to.
No, it's got to be, you got to be registered with the school in a classroom.
Okay. Yeah. And it's a lot of, from when I investigated when I was there, it's a lot of hours. I mean, it was like, I don't know, 20 hours a week.
A lot of hours.
Like that. That's a lot.
Right. They don't play. Yeah. Somehow Carlton knows how to get around that. Mm-hmm. He knows how to get around. There's people here that do it that don't actually go to the classes. And then they have what they call, once you're here, they have nights where you go to language exchange, where there are Colombians who want to speak English, and there are guys like us who want to speak Spanish. So we just talk back and forth and socialize.
Yeah. Okay, so let me take even one step back, because I think there's a step I missed. Before you can fly into Colombia, you have to have insurance. You have to have, is it not health insurance, but travel insurance before they're going to let you in, specifically because of the virus now, right? And it's not expected to open until September 1st.
Right. I think that you're going to have some type of traveler's health insurance, a traveler's insurance that covers health, because they don't want you to be a burden on them when you come in. Yeah. You know, but like I mentioned before, if you're in another foreign country, I would have a blank credit card so that if you get injured or sick or something, you can just use that credit card. Because when they check you in, that's the first thing they'll ask you for. How can you pay for this? So you pay for it by your credit card. I have a credit card with a balance on it that's zero. That's credit up to $12,000. But I told you yesterday, I got sick in Thailand. I had a virus, and I was in the hospital for 10 days, and I was bad off. I don't know what I got, but I was in there for 10 days in Thailand. The bill was $1,100. And then I went back to America, and Kaiser reimbursed me for all of it. All I did was I asked the hospital for the paperwork, computerized paperwork, excellent hospital. They got the best hospitals here in these countries. One quick example, I was in Thailand a year ago last January, and I was limping. My knee was just, I was limping. I don't know why I was limping, but my knee really wasn't hurting that bad. I went to the hospital. I got an x-ray in the hospital. They x-rayed me, told me I had no fluid on my knee, but no bone to bone. The guy x-rayed me, filled my knee with a substance called hyaluronic acid that's in your body anyway. He put it back in my knee. I haven't had a problem with my knee since. So these hospitals are amazing. I was in there for 2 hours and I was out.
Yeah, a lot of people need to realize that, just because you live in America and you think it's a first world country, that the medical care is best in the United States, it is not.
Right.
It is definitely not. Same thing with safety and so on. So first, so before you get there, you need to have some type of traveler's insurance that includes healthcare before you get there. When you get there, you go through the process to get your cedula. That's going to take you go through the process to get your visa, which in the case, the easiest way, again, and the quickest way probably is to get a student visa. You pay the money. It's going to cost you about $1,500, but that's for the entire year, and that includes the classes. So once you get that, then you can go ahead and apply for your cedula, which takes about 3 weeks. Once you get your cedula, you can go through the process of meeting and speaking to somebody to set up a time for a medical, get a medical appointment, I guess 3 weeks later, where that person takes you in, steps you through the process, speaks the language for you, unless you speak Spanish also. And then you have your healthcare takes effect immediately at that point in time. And the two healthcare, I'm sorry, go ahead.
No, you go ahead. I'm finished.
Well, I was going to say that the two healthcare providers are either Sanitas or Sura, right?
Right.
Is there a difference between the two? Okay, this was so much information that I had to break this up into 2 videos. So part 2 will be in a couple of days. Please stay tuned, comment, subscribe, give us some information, and give us your feedback on what you know and any information that you want to know about. Follow along.
We have a YouTube channel. Like it.
Please comment and share if you liked the video.
Please subscribe and kick the bell.